Hi, my name is Martha, and for my demonstration of my skills for the range of motion tests, I will do radial deviation, I'll do great toe extension, and then I will do cervical lateral bending. And let's begin.
Go.
So for radial deviation, I'm going to go ahead and line up the stationary arm bisecting the ulnar and the radius. And then the mobile arm is going to be on her third metacarpal. And then I'm going to feel for her capitate. So I'm going to go down her third metacarpal, and then when it dents in, that's her capitate. And I'm going to put that there for her axis of rotation. And then Hannah, I'm going to have you move your hand in towards your thumb like this. Don't use it to walk it, just move it as far as you can. Stop walking.
I can't.
Just as far as you can. You don't have to push yourself and break your hand. Okay. And then her value is 18 degrees and normal is 20. So next we're going to move on to great toe extension. So for this, we're going to line up the stationary arm with the first metatarsal, and then the axis of rotation is this first MTP joint, and then the mobile arm is going to be lined up with this proximal phalanx. So next, Hannah, I want you to pull your toe back to you as far as you can. 77 degrees and normal is 70. So next we're going to do cervical side bend. So for this one, we're going to line up the stationary arm perpendicular to the floor, and then this mobile arm is going to be lined up with her occipital protuberance, but the axis of rotation is going to be lined up with the C7 vertebrae. So it's right here at this bumpy point. Now Hannah, I want you to try to touch your ear to your shoulder without, don't bring your shoulder, just your, okay? And that's about 47 degrees and normal is 45. Next, for manual muscle testing, I will start with testing the middle deltoid, and then I'll test the iliopsoas, and then finally I'll finish with testing the lumbar trunk extension. So in order to test the middle deltoid, first we need to know that the origin is on the acromion, and then the insertion is the deltoid tuberosity, and then the action is abduction. So Hannah, I want you to go ahead and show me that you can do this. All the way up and all the way down. Can you do it with your arm straight too? All the way up and down. Okay. So she has now cleared a 3, so I'm free to go ahead and add some resistance. So I want you to go ahead and sit towards the edge here so you're back. So you're going to hold this here. I'm going to push down. Don't let me. So that's going to be a 4. To test the iliopsoas, it's important to remember that its origin is from the iliac fossa, and then also the transverse processes in the vertebral bodies of T12 through L5. And then it inserts at the lesser trochanter, and its action is hip flexion. So Hannah, I want you to go ahead and raise your knee up a little bit like this. Right here. Okay. Now, can you do it all the way? No issues. Okay. So she's now cleared a 3. So now I'm going to add some resistance. Go ahead and raise it up again. Now don't let me push it down, okay? Once again, that's a 4. So to test for the lumbar trunk extension, we'll be actually testing the erector spinae. And for this, it's important to remember that the origin is the lumbar vertebrae, the iliac crest, the sacrum, and then the spinous and transverse processes. And then it inserts on the ribs and then the transverse and spinous processes, but superior to the origin. And then its action is going to be bilaterally extended extension this way, but then on the same side of the muscle, it'll be unilaterally side bending. So in order for this to happen, Hannah, I want you to go ahead and extend your back as far as you can, like this. I don't know if you can see. But you're just gonna bend off, lift your chest off. Your chest has to be up, and I want you to try to hold it for 5 seconds, okay? Oh, hang on, go down. I have to hold your ankles. Ready? And go. Okay. So I'm gonna go ahead and give her a 4+ because she started to struggle just towards the end there.